this research touches on metabolic adaptation during tumor transformation, and we've used metastatic melanoma as a model, and in fact BRAF mutated metastatic melanoma, where there is a clear oncogenic pathway that's activated inducing transformation. And there, when cells get treated with BRAF inhibitors, they acquire very rapidly, as do patients, resistance to BRAF inhibitors. And with that resistance come a very pronounced metabolic adaptation. Now, what we have observed is that among the metabolic pathways that get adapted in melanoma, there's the way the cells make NAD. And we have observed that they make a selection among the 4 pathways that they can use to make NAD, they select one, which is the NAMPT dependent pathway. And so all NAD production of the cell goes through this pathway. Now, importantly, there are NANT inhibitors that can be used and that have been used in the past in clinical trials. And so one possibility would be to combine BRAF inhibitors with NANT inhibitors with the attempt to prolong responses or at least delay the acquisition of resistance.